Gentlemen, good morning from sunny UAE. Obesity and lifestyle medicine for the next 1 hour. Now, I have a question, and that question is obesity a consequence of genetics, excess diet, lack of exercise, or inappropriate behavior? I ask this question simply because, and are the remedies uh, related to these subjects? So, is it medical? Is it surgical? I ask these questions because till date, this is our fifth or sixth seminar, perhaps seventh. Till date, we have individual speakers on diet. We have an individual speaker on exercise. Last week, we had a speaker on behavior. We've had speakers on medication and perhaps surgery. So, is it these individual factors, or do we combine all of these factors into a single comprehensive solution? And if so, how do we do that? We need to, I'm sure, pick out what is integratable, what is relevant in diet, what is relevant in exercise. How do we integrate medication into that? How do we manage surgery within this scenario? It's rather complicated. However, we have with us today Dr. Wilku. Now, you have all seen Dr. Wilku when he asks questions at the end of the program. But in this instance, Dr. Wilku is the speaker and we will ask the questions. But he is eminently qualified to be the speaker, and you can see it right up there in the first line. Dr. Wilku is an ACLM certified lifestyle medicine specialist, which means that he has a unique skill and knowledge, certification to integrate all aspects of a subject and bring out a single lifestyle solution. Integrates lifestyle into the lives of corporate employees. Until date, he has, as of last count, he has managed more than 70,000 lives. 70,000 individuals have taken the benefit of his advice. In addition, he is also a certified registered homeopath, and which has a heavy leaning in lifestyle, and he associates that knowledge in his work also. He has worked extensively in the UAE, of course, and also in India. He was with Tatas earlier. He was working for the Tatas in terms of lifestyle management and corporate health. He then moved on to supporting Apollo Hospitals, Lifetime Wellness RX. I recall he was supporting Apollo Hospitals there. And then when we came to the Middle East, to the UAE, we couldn't do without Dr. Wilku, and we invited him to come over here and work with us. And he is a major leader in several areas: lifestyle and occupational health. He has conducted more than 2,600 disease management talks. He helps us with school health. He put together the COVID scan, several rehab scans, including the weight loss, obesity uh, vertical, which we are looking at and working on. He manages all our webinars. I can say much, much more about Dr. Wilku, and that will take the entire hour. So I will simply leave it at that and leave all of us in the efficient hands of Dr. Wilku. Sir, you.
Thank you, Professor Kennedy, for a wonderful introduction. Thank you very much. You are our mentors. You guide us for a lot of things. So that's the reason we are here today. Okay, let me share my slides. So this is nice. So, hello friends. Welcome to another session of OBEFIT webinar. And like Professor said, we have been doing so many events every year. It's good to know that there is an awareness and people are now concerned about their health. We are being conducting diabetes challenge and weight loss challenge, both. And today we are talking about obesity and the lifestyle medicine. Before we go forward, just for your knowledge, WHO has included obesity in the list of chronic disease. You may be wondering why. The reason of WHO listing is just because obesity has a direct impact on your health conditions, especially the chronic conditions. Now, big question, is overweight and obesity same? Because many people are confused about this. So let's see your condition. What is your condition? Where you stand? Whether you are overweight or obese. Now, if your BMI is between 25 to 29.9, you seem to be overweight. And what is overweight? It may be due to heavy bony structure, fat, and muscle mass, like the bodybuilders. They are not obese. They don't have fat, but they are overweight. But if your BMI is more than 30, then you are obese. And there is a lot of fat tissue deposit in your body. With more obesity, increases the risk of chronic disease as well as the complication of the chronic disease. Now let's understand the grading, and the grading is required just to plan the weight loss challenge or weight loss protocols or weight loss plan or disease management plan, whatever you may call. Now, obesity is graded into three categories. If your BMI stands between 30 to 34.9, then you are in grade 1, which is known as mild obesity. If your BMI is between 35 to 39.9, then you have grade 2 obesity. That means you are moderately obese. But if your BMI is above 40, then you are in grade 3, which is known as gross obesity. Means you have a lot of fat in your body. Generally, those who have obesity of grade 2 and grade 3, they have more fat deposited in the visceral layer. We'll be talking in the next slide. Most vulnerable reason for all chronic disease, whether it is risk of chronic disease, whether it is complicating the chronic disease. Now, there are too many informations on the weight loss in the internet. You might be watching reels, stories, which are advocating weight or fat loss in few days or within a week. And people try their best to do it, but without getting an actual results. So, not every obesity health tip is for all. Let's understand why. Obesity is classified as a low to high risk according to the accumulation of subcutaneous visceral fat. What is subcutaneous visceral fat? It's a fat accumulated under the skin, whereas visceral fat is a fat stored between the abdominal organs to pack them safe. Now, if a person has low fat in the subcutaneous and visceral layers, he remains as a low risk, at low risk. Whereas if the person has a fat, more fat in subcutaneous, but less fat in visceral layer, he remains in a moderate risk. Whereas the person who has a high fat accumulation in visceral layer than the subcutaneous, he is at very high risk of chronic disease as well as its complications, such as if we talk about the chronic disease, it increases the diabetic burden by 44%. That is all connected to metabolic syndrome. Then 23% of ischemic heart disease, even 7 to 41% of cancers, different cancers like colon, rectal, or liver cancers. When we talk about the effect of obesity, it's interesting to know how it creates health hazards. So when we are talking about overweight, now we'll talk about overweight also. Overweight also has an effect on the body. Overweight generally impacts the skeletal system and with extra load on the joints, leading to degenerative changes like osteoarthritis, disc herniation, lumbar spondylitis, many things which can be giving a load to the skeletal system and joints. But obesity causes various complex metabolic disorders leading to type 2 diabetes, like I just now mentioned, dyslipidemia, hypertension, ischemic heart disease, stroke, fatty liver, gallbladder stones, even certain cancers. So, talking about immediate impact of obesity on the body is a sleep apnea, a breathing difficulty on lying down due to increased abdominal pressure on the diaphragm. Even 5 to 10% of weight loss gives a beneficial result in reducing the health risk, like we were just talking about. Let's see what are the risks of obesity. The risk can be classified into three major categories. First is non-modifiable, which we can't change, like the family history of obesity, which has 30 to 70% related genes, where 25% of the genes are having relation to predisposition with polymorphism, as well as your age, your gender, your race. You can't change these things. Then comes the medical factors, where there is a metabolic or hormonal influence like PCOD, thyromegaly, fatty liver, hyperlipidemia, also certain medications like beta blockers, corticosteroids, but these can be managed by medicinal intervention. Then, lastly, which is very important for a weight management program or any chronic disease management program, are the modifiable risk factors, which we can definitely modify with the help of lifestyle modification, like insulin resistance. By lifestyle modification, we can reduce the insulin resistance and increase the sensitivity. Sedentary lifestyle, chronic stress, alcohol, tobacco, and of course, the faulty diet, which increases the calorie consumption. Now, weight loss program is not a quick fix. It's a journey, takes time and consistency, which strictly includes three basic influencing factors like behavior management, that is your understanding the relation of obesity to the health, proper balanced nutrition. I'm not talking about diet, I'm saying nutrition. And very important, consistent physical activity. With any factor missing, may give a weight reduction, but it will not last for a long time. So, if you want to have a sustainable weight loss or for a longer period, then you require all these three to be considered and strictly followed. Weight loss could be planned according to your goal, short term goal or long term goal. Suppose if you are going to attend some party or event and you want to reduce your weight to get fitter into a smarter apparels, then your goal is different. But when you are talking about, when you are thinking about chronic disease management, or if you want to get reduced from the chronic medication and you want to live healthy, then you have to goal a longer term. Okay, so how we are going to do this for weight management program? In earlier webinars, are all speakers like Professor was mentioning about it may have spoken about many points which are similar, but I consider repetition of similar points in a different way gives you better grasp of the knowledge and gives you good knowledge. Hope you all agree. Now, for fruitful benefit, to get maximum benefit of your weight loss management program, we need to understand the ways of assessment. What assessment you are doing, the metabolism of your body, the calorie consumption you are taking, basics of nutrition and various format of weight loss diets, ins and outs and pros and cons of everything, and then exercise components. Then at last, if there is something which is making you restricted to get moving forward, then there is a medicinal or non-medicinal intervention to support you. Now, talking about the obesity assessment, such as height and weight ratio, which is taken in feet, this helps to indicate your healthy range of minimum to maximum weight of a person. Then comes Broca's index, which height is taken into centimeters and 100 is minus from the height. Gives your ideal body weight. Okay. So third comes body mass index, which is very popular, used globally, and this is the best tool for obesity management. Okay. This is used by all the professionals to grade obesity, grade 1, grade 2, grade 3, and plan the protocols according to the grades. Then comes body fat measurement. This is also very helpful tool because this helps you to plan a weight loss program according to the associated chronic disease along with obesity. So body fat measurement is a tool to analyze the distribution of the fat around the body, where it is distributed, where the accumulation is more, and what are the consequences of that. Like we spoke about subcutaneous and visceral fat is useful for weight loss challenge for the people for chronic disease conditions. Next comes waist to height ratio, or otherwise what we say waist circumference. This is useful to assess a cardiometabolic risk, especially to understand the visceral fat, whether there is more of visceral fat, or if there is more of visceral fat, then you may be having a risk of chronic disease. Lastly, the lab test, the blood test, what we call ultrasound or radiology, whatever, any medical intervention to assess, like lab test, lipid profiles, thyroid profiles, glycated hemoglobin, liver function test, urine analysis. These help to understand the secondary effect of obesity. And accordingly, you can plan your weight loss management. So this was the basic understanding. Now we are talking about the metabolism. What happens and how much calorie you require for that metabolism. So basic calorie requirement and how the body adopts it is very crucial to understand. Our body requires 1,200 calories to run the physiological system. Means your all the system, respiratory, cardiology, urinary, neurology, all systems are functioning with help of energy. From where that energy is coming? The food what you are eating. That consumes 1,200 calories. And our daily routine consumes 600 calories. Now say if you go consume 2,500 calorie, which is an average calorie consumption by an adult, your system consumes 1,200 calories and your routine consumes 600 calories. Still, there is leftover of 700 calories. This excess calorie is stored as a fat for a future use. Body stores it wherever it is required for extra energy, or sometimes when you are eating less, so calorie can be balanced from there. That means 700 calories per day translates into additional of approximately a kg per week. And this translates the weight gain. That is good for people, those who are underweight, but not good for people, those who are already overweight. But when we talk about balancing the calories, and if you want to lose weight, then you require to balance your input as well as output. The input of the calories and output of the calories by expenditure. So you may be thinking how. So earlier slide we saw 1200 calories and 600 calories are being used by your physiology as well as your daily routine. Now, when we do exercise for an hour, it roughly consumes 700 calories, and depending on the exercise activity, it leaves no excess calorie to store. Means output is balanced. This results in no weight gain. I'm saying no weight gain. Now, if you want further to reduce your weight, existing weight, so reduce intake of 500 calories translates into 3,500 calories intake per week, resulting in a kg loss per week. Okay, now you started losing weight. Okay, maybe wondering how. So let's clarify a little bit more with this. For better understanding of calorie reduction, it's important to understand the metabolic process, how you eat the food, how food is converted to the energy, and how it is being utilized. Okay, metabolic process, food in digestion, conversion of energy, irrespective of weight loss. Like we mentioned, it depends on the food intake, activity output, and most important, the calorie balance. When we eat food, it is converted into glucose, and the rise of glucose level in the blood is countered by releasing sufficient amount of insulin. When physically active, means when you're doing any activity, the metabolism responds by influencing the adipose tissue to release a hormone, adipokines. This is the hormone which is responsible for fat accumulation. Now what happens? Increased metabolism during the exercise reduces the adipokines, means the accumulation of fat will be restricted, and that exercise increases other hormones which are related to adipose tissue, that is adiponectin and leptin. Very interesting hormones. Now these hormones are responsible for controlling your hunger and giving you satiety. Likewise, leptin increases the metabolism and reduces the hunger. This cycle goes on and leads to a healthy weight. Let's give an example. Suppose you you reduce the 30% of your calorie by fat. Many people think, okay, I will reduce fat, I will not eat fried food, I will not eat butter, I will not eat ghee, or anything which has fats, cheese, margarine, and many things you can count on. But it will not affect much. If we reduce 30% of the calories from fat and retain the carbs intake, whatever you are having in the carbohydrate, it will still balance the overall calorie in the body, which is not beneficial. But if you really want to reduce the weight and reduce the fat, especially the reduce to fat, then if you reduce 30% of calories from your carbs, then it helps the stored fat to balance the required calorie. Your system requires 1200 calories, and if you are reducing from, and your 600 calories required for your daily routine. But when you do 30% of reduction from your calorie carb, then the stored fat is being utilized to burn, to convert the stored fat into energy. Now, this reduced overall calorie is shedding of the stored fat. That means always think to reduce the carbs first. Don't think of reducing fat and other things. We'll be talking about the different popular diets, with benefits as well as their cons also. This is the best way to burn the stored fat in your body. understand our goal, what we want to achieve, reducing weight, overall weight, or focusing on reduced body fat. Now, obesity is manageable and we can live a long, healthy life with reduced risk of chronic disease. Simply targeting the BMI means the fat. Now, how we can do it? We can have the first tool, that is the dietary management. That plays an important role for the weight management. You should be having a good knowledge about nutrients and supplements. This webinar will be talking more on nutrient and supplements. Our dietitian has spoken about controlling the calories and other diets also, but we will be focusing the physiology, how the physiology is being impacted by nutrients and supplements, and then diet, calories, and rules of nutrition. First, what we eat reflects physically. If your body is a source, if your food is a source of energy, it should be also helping to regulate your physiology. Not only eating food, getting energy, and you are running your body. It's not. It should be regulating your physiology in a healthy way. So, talking about nutrients, the first component, what we were saying, becomes very important to know, and how nutrient and supplements regulate your metabolism. First comes the vitamins. Vitamins play very important role in the weight loss journey or fat management by influencing and regulating the hormones as well as promoting the metabolism. Earlier slide we spoke about how it happens. The first vitamin is vitamin E, which is very rich in antioxidant and helps to repair and prevent the cell degeneration. It promotes cell acceptance. Cell acceptance of what? Of insulin. Insulin is what? Insulin is a carrier which takes the glucose to the target cell. So cell acceptance is being promoted by vitamin E, and it increases the insulin sensitivity, reduces the resistance. Where you will get a rich source of vitamin E? Soybean, sesame seeds, cotton seeds, and corns. There are many, but these are the common what we eat on day-to-day basis. Then comes vitamin B3. Again, this is also very good, but for what? This is very good for beta cell function of the pancreas. What is beta cell? This is a cell which is responsible of production of insulin. Okay. Now, what is insulin? Insulin is a carrier. Just now we mentioned it carries the glucose to the cell. So beta cells produce insulin, and vitamin B3 helps in proper production of good quality of insulin. Also helps to manage the lipid and protein metabolism. Lipid metabolism, what we generally say fat metabolism or cholesterols or whatever you can easily understand with. This is also a metabolic syndrome. So this vitamin B3 helps to regulate your metabolism. Red meat, fish, ripe and spotted banana, fortified cereals. These are good source for vitamin B3. Next come vitamin B6. This helps red blood cell formation, responsible for regulating your HbA1c, that is glycation of the hemoglobin, as well as neurotransmission to regulate the hormones by suppressing serotonin, increasing dopamine to balance hunger, and also resulting in reduced stress. Just we spoke about, we'll be speaking again in the next slide also, the leptin, the hunger hormone, the controlling hormones, leptin and ghrelin. We'll be talking about that. So vitamin B12 helps formation of RBC, like, vitamin B-C helps cell growth, cell repair, as well as helps to regulate the ion exchange, leading to an enhanced insulin sensitivity. Now, what are the good source? Oranges, strawberries, blackcurrant, broccoli, Brussels sprouts, bell peppers. These are good source for vitamin C. Now comes minerals. We spoke about vitamins. Now we are talking about the minerals. These two combine and we are categorizing them as a supplement. Minerals also play an important role in supporting the metabolism. There are various minerals that are required for the body function. Say for magnesium, helps in metabolism, neurotransmission, and acts as anti-inflammatory. It helps to prevent hypertrophy of the adipose tissue. What is adipose tissue? Adipose tissue is the fat which is being accumulated in the body as an adipose tissue. What happens when there is a mineral deficiency, when there is a vitamin deficiency, that fat cell becomes swollen up, hypertrophies, and the area is covered more. So magnesium helps to regulate the metabolism as well as helps as an anti-inflammatory to prevent hypertrophy of the adipose tissue. Also regulates the mood by promoting the endorphins. Pumpkin seeds, almonds, peanuts, all nuts and seeds, black beans, avocado, kidney beans, yogurt, Greek yogurt specifically, broccoli, wheat germ. These are very good source of magnesium. Magnesium is very helpful to control your physiology, your thoughts, your emotions, your nervous system. Works very good. Next mineral comes very important is chromium. This helps to promote insulin production as well as it increases insulin sensitivity. Now, you just came to know before this slide that insulin sensitivity is very important to regulate your fat. Chromium results in proper uptake of the glucose by the cells. And when there is a proper uptake, there is no glucose left out and very less glucose left out, and which can be stored into fat. Less glucose left out, less stored fat. As simple as that. So now, what are the food rich in chromium? Especially is the protein like lean meat, poultry, eggs, seafood, beans, lentils, nuts and seeds. These are very good source for chromium. Now comes the game changer, the enzymes and the hormones. Whatever medication you might have heard, the fat burners, hunger controlling medicines, these are synthetic. But enzymes in the body are natural thing which regulates these things. Now, what are the enzymes? They play a pivotal role in various body functions, especially regulating your metabolism as well as responsible for various factors for metabolism. Enzymes like glucokinase, carotene, and biotin are responsible for insulin production, insulin feedback mechanism, and glucose absorption pathway. Very important to regulate the stored fat. Okay, eggs, egg yolks, especially when you're talking about egg as a whole, I would rather suggest for a half-boiled egg, which is very good in yolk benefits as well as carb benefits also. Nuts and seeds, liver, organ liver, mushrooms, broccoli, spotted banana. These are very good source of enzymes. Another game changer are the hormones responsible to regulate your hunger, satiety, and metabolism both. These are leptin and ghrelin. This regulates your fat metabolism as well as it helps to control your hunger and controls the energy expenditure also. Whereas another hormone is cortisol, a natural steroid and a neuropeptide, the neural protein which regulates the stress and mood and influences the fat metabolism by burning it out. Okay, by regulating your serotonin. Berries, neutral oils, leafy vegetables, legumes, salad greens are very good source for these hormones. Then comes the polyphenol. This is like having a dinner or a breakfast or a lunch along with your dessert. These are polyphenols, which has strong antioxidant property. theoretically it doesn't do directly any impact, but it has an antioxidant property which helps to regulate your metabolism by preventing the free radicals. Your system is generating many vitamins, they are generating many enzymes, they are regulating your minerals, whatever you eat. So anything which is not used and moving free around, it oxidizes it. So to reduce the oxidation, it helps as antioxidants. From where you will get green leafy vegetables and all raw fruits are good source for polyphenols. Diet and calories. In earlier slides, we spoke about for weight management, you should be balancing, you'll be reducing the calories intake. We call weight loss diet as a hypoglycemic diet, which means any food which gives you low glycemic index or low sugar levels. Sugar levels are mostly coming from your carbs. That means you should be controlling your carbs. Now there are different type of diets. You can search in the Google, you will find many, but we are talking about the pros and cons of it. So dietary diet for weight loss has three basic variations. One is a therapeutic diet, which considered weight loss along with managing a chronic comorbid conditions. When you have a comorbid condition, chronic conditions like diabetes, cholesterol, cardiac metabolic syndrome, or anything like that, which for which you are taking chronic medicine, this therapeutic diet will help you. So there are popular diet as well. So like first comes most popular, most advised is the Mediterranean diet. Okay, this is a balanced diet, and it is known to be most effective to manage your chronic condition as well as to lose your weight. Along with, if you have lost your weight, it will help you to maintain your lost weight. It includes the balanced portion of complex carbs, not the simple carbs, fresh fruits, vegetables, and it also suggests to avoid simple added sugars. Okay, the Mediterranean diet is good for heart, brain, and overall health. That's the reason it's best advice for disease management. Second comes the Atkins diet, most popular during 1960s. In 1960s, a cardiologist, Dr. Robert Atkins, designed this weight loss diet for patients who are suffering from heart disease. It was very good. Atkins diet mainly considered restricting carbs, allowing less than 20 to 40 grams of carbs daily, but preferably from the complex carbs for straight 14 days. The required calorie can be compensated by protein and fat after 14 days. For strictly 14 days, very less carb, maximum 20 to 40%, and that too from a complex carb. After 14 days, then you can compensate your deficiency of this calories by protein and fat. By this method, the Atkins diet results average weight loss of 5 kilos in 14 days, even if you are not doing any intensive exercise. Simple walking and simple exercise means you are being active. The next comes the GM diet, which was again very popular diet. GM diet was designed by General Motors. Many of you may be using the cars, the Ford and GM cars and other things. So General Motors designed this diet, especially for their employees to improve their health. The simplicity of this diet is very interesting. This diet includes raw fruits, raw vegetables, lean meat, complex and whole grains, and plenty of water. How you are doing? it's a day 1 to day 7 journey, one day this, one day that, one day the third day this. Like this, you are having a certain category of food intake. Now, GM diet gives faster weight loss, approximately 6 to 7 kilos in a week, which is very interesting in comparison to Atkins diet. This gives you much benefit, but still is not good. It's not very beneficial because it contains high fiber. When there is high fiber, there is less of protein, less of vital nutrients. Means you are lacking and you are having a deficiency of that. So you should be very careful. And it leads to dehydration. It slows metabolism. That's the reason free fluid intake, especially free water intake, is suggested to keep yourself hydrated. Another popular diet was zone diet, which was designed by a very serious biochemist. Theoretically, what he studied and he researched, that even now we were talking about, whatever calorie extra is left out, it is being stored as fat in the body for future use. And what is being used when we eat food? Food is converted to glucose. Glucose is a source of energy. Glucose is being taken to the cell by insulin. And there is an insulin feedback mechanism, right? So this zone diet follows that method. With the rise of glucose level, there is a subsequent rise in insulin to counter it. That initiates lowering of the blood glucose level, resulting in increased hunger. When you restrict, the hunger will need the calorie. Then your stored fat will be burnt out to give calorie back. This is purely an insulin feedback mechanism. The general meal portion ratio should be 40% carb, 30% fat, and 30% of protein. But this gives 2 to 3 kgs weight loss in 14 days. Very slow. Because you are not doing, you are allowing everything, but in a controlled manner to regulate your insulin mechanism, feedback mechanism. So these were some popular diet. Not every plan suits to everyone. Before adopting any popular diet, you should be consulting your physician to assess your chronic ailments, and according to that, you should be planning your protocols. Next comes the interventions. Okay, we spoke about many things. We spoke about diet. We spoke about the metabolism. Now we are talking about the other interventions, what we can do. For a weight loss intervention, management intervention, we must follow a strict plan, stage by stage. Your first attempt for a weight loss should be done with healthy lifestyle, including your controlled diet and regular physical activity. Then comes the second phase. If you're not getting that much of result, then comes the second phase. When or else if your BMI is high, above 30, then 20% of the weight should be managed by existing conditions also, like drug therapy, fat burners, hunger control, restrict your absorption. These should be considered. I was talking about the supplements and nutrients, which we are doing naturally the same thing. When you have any chronic conditions, when your weight is more than 20% of your normal weight, or if your BMI is more than 30, or if you have chronic disease like cholesterol, hyperlipidemia, and diabetes, then you should be thinking about drug therapy. Your doctor, your physician will be suggesting it. Don't do it yourself. When these gross obesity with BMI more than 40%, then or 50% of your normal weight, or chronic conditions, and you have a restricted physical activity, then surgical intervention is advised, like bariatric surgery, liposuctions, or balloon therapy. This will help you, but this is purely suggested by the doctors who are treating you. Okay. Now let's explore some alternative medicines as well as approach. Obesity is caused by broadly due to constitution or a faulty metabolism. These are the two things basically behind your obesity. Constitution is the genetic signature of your body buildup. Like your bony structure, you may be having a heavy bones. Your blood type, like some blood groups are very reluctant to reduce weight, but very easily they can gain the weight. Then elemental composition of your body. When constitution is tough, it becomes difficult to lose weight and even more difficult to maintain the lost weight. Let's look some of the homeopathic popular medicines which work on constitutional remedies as constitutional remedies, and they help in your weight loss journey by influencing the constitution of your body, such as Calcarea Ka. This is a remedy suitable for people who are flabby, whose appearance and body construction is flabby, they are pale and have profuse sweating, especially in the children. That promotes your metabolism to work faster to give you better results. Ferrum metallicum suits for young girls who are anemic, pale, and has retained body water in the body. Ammonium, people with extreme lethargy, getting tired very fast, slow metabolism, have disposition to fat accumulation in the lower body. Again, lower body, belly, waist circumferences we spoke about. So this is what we are saying. Then graphitis, suitable for females with hormonal imbalance, irregular menses, habitual constipation. Phosphorus suits for people with constitution having imbalanced growth hormones, are anemic also, and have a growth spurt during the puberty and adolescence. Let's see the remedies which promote metabolism. Like Fucus Ves, it's very good remedy which regulates your glands, hormones like thyroid. Phytolacca again is very good for glandular disposition and promoting the hormones. Thyroidinum, straight away medicine for thyroid, and this is basically for sluggish thyroid and imbalance of hormones due to thyroid. Lycopodium, it promotes a sluggish liver. If your liver is not able to manage, digest properly and regulate your cholesterol levels, then lycopodium is one of the best medicine. Then comes naturopathy and obesity. That offers a range of healing therapies that contribute to weight loss and obesity management. Hydrotherapy, using water in several ways, including bath, showers, and water compress to stimulate the detoxification, boost your circulation, and speed up the metabolism. Mud therapy, applying therapeutic mud packs to your body stimulates your lymphatic system to promote drainage and to help eliminate the toxins. Then comes yoga, a deep acting passive method of exercise which incorporates the physical poses, pranayama, and meditation to encourage mindfulness, managing your stress, lowering the stress, and improving the hormones, the stress hormones, to regulate your body. Again, in naturopathic approach, there are a lot of herbs, spices, and organic extracts which are very helpful to promote metabolism and regulate your hormones also. Like fenugreek, reduces your appetite and food intake, regulates your insulin feedback mechanism, and promote the insulin sensitivity. Cayenne peppers contains capsaicin that increases the metabolism. Actually, by burning it, the capsaicin is like a burning agent. So increases the metabolism, reduces your hunger, and promote the gut enzymes. That means the proper digestion as well as proper absorption and assimilation of food you eat. Then comes ginger, a strong antioxidant, helps to increase metabolism, promotes fat burning, and reduces the hypertrophy of adipose tissue also. Oregano contains cavachol, This is a natural antibiotic and antioxidant, helps to regulate the fat synthesis. Ginseng, again, reduces and delays the absorption. Caralium fibrinata is an edible cactus with a strong antioxidant and helps to reduce your appetite. Turmeric, everyone knows, it's used in the kitchen. It contains curcumin. It's a strong anti-inflammatory, produces reduced effect on hypertrophy of the adipose tissue. Black pepper, like cayenne pepper, it is also a pepper which contains piperin, having the same effect. Cinnamon, this is very interesting. This mimics as an anti-glycemic agent and increases insulin sensitivity, regulates the insulin pathway and fat metabolism. Similar way, Gymnema sylvester, same anti-glycemic and regulates your blood glucose level. Next comes the exercise. I think we are already running short on time, but I will just cover 2-3 slides more. Now, exercise and fitness. You know, exercise is the second most important tool for weight loss. When you start a weight loss journey, for best results, you should be having your exercise regime daily for first 6 weeks when you start a program for weight loss challenge. And exercise should have a component of stamina, strength, and stretching in a ratio of 50-30-20 to improve your cardio stamina, improve your muscle strength and muscle tone, and increase your flexibility. After 6 weeks of daily activity, if you continue the same pattern, it's very good. Or else you can reduce to 3 days of cardio, 1 to 2 days of strength and flexibility exercise. This will help you to maintain your lost weight, whatever you have lost, and it will help you to continue the weight loss. Now, only doing exercise, many of the people you might be coming across, they say, okay, we are going for exercise, we are going for walk for 1 hour daily, but still my weight is same. I'm not able to reduce my sugar level. I'm not able to reduce my cholesterol level. That means there is something wrong. So what is that wrong method what you are following? Maybe you are not having a proper output. How this proper output will be? You must be following a FIT formula, what we call frequency, intensity, time, and type. This means your exercise program should consider the frequency, that is exercising time, how much frequent you are doing your exercise, daily, once in a blue moon, or once in a year during the challenge. It all depends on you, the frequency of your activity, and any time convenient to you is good enough. Only thought, what I spoke, the first tool for this was pillar was behavior management. You need to strict on your behavior that I have to do. Then comes the duration, how much time you are spending. People say 45 minutes, 1 hour, 2 hours they are spending on gym, but they are not getting results. So at least minimum of 30 minutes of daily intense activity, where your heart rate should be between 150 to 130 beats per minute. The last comes the type of exercise, what you are doing. Cardio exercise, weight training, and stretching, or yoga. All routine exercise of 1 hour. If you are going to a gym, if you are not going to a gym, if you are doing at home, if you are doing exercise for 1 hour, you should divide your time for different components. In 1 hour of exercise, you should have 30 minutes of jogging. If you're doing a jogging, you should be going outside, brisk walking, jogging, or jog run, or jog walk, or running. It all depends on your skeletal conditions. Please, if you don't have any joint pains and other things, you can do it. Or else, if you are having a cross trainer at home, or if you are going to a gym, use a cross trainer. You know what is cross trainer? Stepper and with the handles on it. So followed by a spot running or rope skipping for 1 minute. are followed by then muscle training, calisthenics, then 10 push-ups, 10 to 20 squats, 8 to 10 explosive lunges of each leg, finally working on your belly muscles, the core muscles. Generally, I personally don't advise using a treadmill for grossly obese people or BMI more than 40, or those who have heel pain, knee pain, or hip pain, or even lumbar spondylitis. Don't do it, because that will also complicate your joint pains. So, core exercise are next level of exercise, or next phase of exercise, which will strengthen your core muscle, the belly muscles. This is a target muscle group exercise, important for fat reduction, toning of the belly muscles, and it will help the muscles around your belly, buttocks, and side tires. Core exercise is very important. Not only it tones the muscles, but it helps to increase the lymphatic drainage. Means it helps to reduce the water content in your body. Finally, helps to burn the subcutaneous fat. Now, winding up whatever we spoke about since starting, let's review what are the things we spoke and how we are going to take it as a health tips. First for all, get assessed by your physician. Don't assess yourself. You may not be having any disease condition, but it's better to be assessed by your physician so that he knows what exactly your health status is and what is you things you can do and what are the things you can avoid, especially when you are having a chronic health issue. Then plan your according weight loss regime, considering your diet, exercise, which is suitable for you, which is the way you eat, whether you are a vegetarian, whether you are a omnivorous, whatever the diet pattern you follow. You can consider the dietitian consultation. You can talk to your exercise specialist and lifestyle counselor. Compromising your health. So the tips what we are talking about, you should be dieting, but not on a crash basis. Why we are saying this? Because we initially we spoke about your physiology system requires 1200 calories to run the system even when you are sleeping, not active. So when you are doing a dieting, your calories should not reduce 1500 calories. At most, never below 1000 calories. This will start a ketosis in your body. That will be a very problematic thing. If you have any chronic condition, even if you have any family history of chronic condition, you will be at higher risk of it. The best way is your calorie intake should be balanced by your calorie expenditure. Whatever you are expending, whatever your activity is, how much calorie you require, it should be balanced by your intake. Don't exceed the calories. Exercise lightly at least once or twice every day. The best way to, whenever you are doing exercise, that's a separate, but when you have a heavy meal like lunch or dinner, then you go for minimum 15 to 20 minutes of simple walk to boost up your metabolism. Weigh yourself, measure your weight weekly, not daily. Many people do go daily weighing, and that too, when you are doing it weighing, it should be weekly. At the same time, the time duration, the circadian cycle also changes the weight of your body. When you get up in the morning, after getting fresh, you should be weighing, because that is the best time to have a bare minimum weight of your body. Throughout the day, the accumulation of your blood fluid running in your body, the food you are taking, the calorie converting, everything is going around. And you should be eating all meals, including the breakfast. Many people skip breakfast or skip anything. It should not be like that. Your physiological clock is running according to the calorie intake. and food you eat. Then comes avoid as much as you can the simple sugars, soft drinks, cold drinks, milkshakes, pastries, cakes, even artificial sweeteners. Okay, because artificial sweeteners are low in calories, definitely they are low in calories, but they still have high glycemic index, which reflects or regulates your insulin feedback mechanism. Try to avoid that. Avoid animal fats. Okay, animal protein like red meats, any of red meat. There is no such lean meat. If you go to a supermarket, then you're getting, they are promoting or selling meat as lean meat. They take it out all the fat, visible fat, and say there is no fat in the meat. No, red meat, each fiber of meat has fat envelope on it. Each muscle fiber has fat envelope, so you cannot get rid of the fat. Avoid dairy products which are high in fat, including cream, butter, cheese, clarified butter, that is ghee. In the Asia, we call it ghee, palm oil. These are the things which we should be avoiding, and especially full fat milk. Eat low fat Greek yogurt every day. That is very good. Always eat a complex carbohydrate when you are having carbohydrate in your food. Whole wheat, whole grain, the complex carbohydrate should be there. Try to increase your intake of green vegetables, as cooked vegetable as well as a raw vegetable in salads, and fruits for roughage, and vitamins and minerals. Minerals are mainly towards the green leafy vegetables. Vitamins and these are mainly towards your fruits. Try to maintain your meal timing, because there is a physiological clock running according to your regular food intake habit. So that time there is the metabolism is high, because the digestion is prepping up for the meal. Eat a lighter dinner, medium lunch, and a heavy breakfast. This is standard saying for old people, the experienced people. They say having a heavy breakfast give you full energy and strength throughout the day. To have balanced energy, you can have a medium lunch, and very lighter lunch dinner you should be taking, so that nothing is being stored. So what are you waiting for? This is time to act. Not only reduction of the weight, but also to prevent and manage your chronic conditions. That was my last slide. Thank you very much. Professor, over to you.
Thank you, Dr. W. Thank you so much. In your presentation, you covered most aspects of lifestyle. You spoke about diet extensively, and I will ask a few questions, clear a few doubts regarding that. You did speak about exercise and yoga, as well as other forms of exercise. You touched upon homeopathy, naturopathy, and herbology. Excellent. Thank you so much for all of that. I have a question which I will ask at the end, but first let me get to my audience's question. Zayed had two questions. I've made a brief note, so it's my interpretation of his question. He had two questions relating to homeopathy. Number one, Zayed's mother is obese and diabetic and suffering from neuropathy, pain. The question is there any help that can come from homeopathy? And at the same time, he asks a second question. He said, allopathic medication for obesity suppresses appetite, reduces absorption, so on and so forth. Do we have equivalently good homeopathic or naturopathic remedies? Exactly up your street, Doc W. You are a certified homeopath. Tell me, sir.
Yeah, it's really an interesting question. See, in that presentation, I spoke about the vitamins and minerals which are very important to regulate the hormones as well as the metabolism. And similar way, there are the herbal herbs and spices as well as homeopathic medicines also, which replicate the same effect naturally. Talking about the first part, Zayed's mother is obese and she's suffering from diabetes and she has a pain and numbness on her legs. Okay. And is it due to overweight? Yes, it may be due to overweight as well as due to complex or chronic diabetes also. So there are medicines which help for neuropathy, especially homeopathic medicines for diabetic patients, those who have neuropathy and pain which is not being countered regularly by conventional medicine. Yes, we have. Like Gymnema, spoke about. I spoke about Amon Muir. I spoke about Sylvester Stallone, and then Focus West. These are promoting weight loss as well as fat metabolism, as well as they are mimicking as an anti-diabetic agent. So this will help to reduce the diabetes. This will help to complement the regular medication they are taking. Plus, it will address the comorbid symptoms which are not being addressed by allopathy. Second part of his question is the hunger suppressant and fat burners. I was talking about that also. It's very common nowadays, like Munjaro, Limbazic, Ozempic. These are medicines which are promoting fat burning. They are reducing the hunger. Taking those medicines will give you a short-term effect. Means till you are taking that medicine, the effect is there. You cannot take that medicine for lifelong. The best way to replicate, to mimic those effects by vitamins, adding your vitamins, which I spoke, vitamin E, B6, and B12. These are mimicking. Then vitamin C. These are things which are helping to promote the metabolism as well as they help to regulate your hunger and give you the sense of fullness. Same way, they are having, there are many homeopathic medicines also, which works. Focus West, I mentioned, Gymnema Sylvester, I mentioned, and this Phytolacca also works as to regulate the fat. They burn the fat by regulating the glands, which are responsible for hormone regulation. So,
Excellent, Dr. W. Excellent. Thank you so much. Now, Rajat is 28 years old. No, I'm sorry, his BMI is 28
yeah.
and Rajat is 32. And he says that the doctor has asked him to lose weight, but he is unable to exercise. What do you suggest?
Great question. See, most of the people, I mentioned about the weight loss journey is not a quick fix. So when you have high BMI, his BMI is 28, means he is overweight. He is not obese, but his job is a desk job and he is having a low back pain. That means he's sitting for a quite long time on his desk. And doctor has suggested for a reduce the weight. You need to do the exercise. Now, what exercise you should be doing? The first thing in your daily routine you should be following. Every 1 hour, you should be getting up of your desk, moving around so that there is less compression on your back. Because when you're sitting, the entire load of your body is on your hip bones, especially on the spine. So you should be releasing that pressure of for by walking for 5 to 10 minutes. Just have a round after 1 hour. That is one aspect. Second aspect, if like you mentioned, I'm not able to do exercise, whether due to medical conditions or he doesn't have a time. If he is saying about, if he wanted to say about the medical conditions, then what I will suggest is go for a cross trainer, which I said there will be no impact on your body. Cross trainer will give you much benefit without impacting your joints. And second, you can, if you know swimming, swimming is the best exercise for people, those who have a joint pains, and it will help you to reduce the weight. Now, Second aspect comes if he doesn't have time to exercise. Then I have spoken about how to control the diet and what you should be promoting in your diet, the vitamins, the minerals, and how you should be controlling your calorie intake and what calorie should be reduced, whether it should be reduced from the fat and or the calories carbs. Reduce your calorie from the carb. Try to reduce as much as the carb and whatever you are having the daily, it should be only 30% of carb, maximum 40% according to your activity. So,
Thank you, Dr. W. Dr. W, you did mention uh, 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 about I wouldn't say you spoke about the keto diet, but you did talk about ketoacidosis in a part when you were talking about the diet. So Pooja has asked a question: is the keto diet safe or is it healthy?
sir, this is very interesting question coming across every time because people that's the reason I told there are many health information to reduce the weight in the internet. Keto is one of the popular top 3 weight loss diet plans. Now, just now I mentioned about individual in last week which I came across and young boy of 20 years age and he was high having high blood pressure. So ketosis, I was talking about the ketosis also. That's the reason in popular diets by professionals is not suggested for a keto diet. Keto diet is only suggested when there is no medical condition, there is no comorbid condition, and your physical appearance or there is no physical ailment which is restricting you to reduce the weight. Then what you should be doing? You should be having more on protein diet, less of carb diet, like zone diet I was talking about. I was talking about GM diet. GM diet also goes for that. Means there is no source of protein, there is no source of regular carbs. So there is even after 14 days, then you are adding little bit of protein or adding little bit of fat to compensate the calorie. When you have obesity, you have lot of fat in your body. When you reduce the diet, that deficiency of the calorie is being uh, replaced by the fat, the stored fat. Then there is no issue. But when you don't have much stored fat, what will happen? Body requires 1,200 calories, which the body will compensate from anywhere. From where? It will start eating the muscles. When it will start eating the muscles, kidney is affected because kidney will eliminate all the toxins from the blood. Creatinine level goes up, urea goes up, uric acid goes up, all are byproduct of protein metabolism. That's the reason keto diet is not very much advised. But if you still want, you can do, but in a proper manner. First, consult your physician, get a clearance, properly get a keto diet by your dietitian. Don't follow anything which is available on the internet. Your dietitian will know your health status and plan according to your health conditions. So,
W. There is, Dr. Anu has mentioned in a single word intermittent fasting with a question mark. And then she mentions that I do this every day. Okay, now, uh, if you go back in time in naturopathy, etc., they would do fasting or weekly fasting and things like that. So now you have something that is called intermittent fasting. And that intermittent fasting would be not eating food for 12 or 16 hours, etc., etc. I don't quite know what Dr. Anu is asking for because the question is cryptic. But my question to you, sir, is would you categorize intermittent fasting as one of the popular diets, or would you put it as a recommended diet like the Mediterranean diet?
sir, again, this is one of the popular methods of dieting. Now, intermittent fasting has its own benefits, but it doesn't impact that much on weight loss. But definitely, it promotes the fat metabolism. Especially, it is very good for chronic conditions, chronic disease like diabetes, hyperlipidemia. If you have a cardiometabolic disorders, so this intermittent fasting is very good tool to counter that. But it gives less impact on your weight loss. Huh. Truly, if you are following intermittent fasting for a longer time, not for a shorter time, means say for 3 months, 6 months, if you are doing, then you will see the weight loss effect. Otherwise, it basically works on insulin mechanism, feedback mechanism. Like I said, your body requires so much of calories to run the system. When you are depreciating any food to come, body is still working. Body requires 1200 calories every day to run the system. Body will start using the fat in your body, deposited fat, and it will start converting back to go in glucose and for energy. So that helps to control the fat. But it's very less, and as soon as you eat, it goes back. As soon as you eat after 16 hours or 14 hours, 12 hours, 18 hours, there are different methods of intermittent fasting. So average is 16 hours of fasting. But when you eat in 8 hours, that immediately redeposits the fat in the body, because the system is already has already consumed the calorie required. So it will again restore the fat back. So that's the reason intermittent fasting is not very good for weight loss, immediate weight loss, I will rather say, but it is very good for maintaining the weight loss and best for chronic health conditions.
Excellent,
So,
excellent, excellent, Dr. W. That was an excellent answer. Thank you so much. You know, I'm going to take up from a remark that Dr. W made about gym trainers. You know, over the years, I have noticed that our medical professionals have more and more become multidisciplined, meaning that our medical doctors now frequently refer to dietitians, frequently refer to exercise specialists, frequently refer to psychologists. And if you were to look at any ailment, well, there's a multidisciplinary team working. Building on what Dr. Wilku said about the creatinine and the client that he was counseling, building on that, I believe our recommendation to all colleagues in the health space should be that in case your client has a medical issue, you must refer him to a doctor before you start advising your exercise. In fact, that is one of the basic rules of exercise. If you have not done exercise, please refer to your doctor first and then start. I think I agree with you completely, Dr. W, that gym trainers, etc., must strictly implement the rule of a medical screening prior to recommending exercise. I agree with you. Okay, we leave it there. Now, I have one quick question, Dr. W. It's a matter of advice. You know, you spoke extensively about nutrients, about vitamin E, about minerals, about enzymes and hormones, etc., etc. And then you also, when you spoke about herbology, you spoke about ginseng, turmeric, oregano, ginger. You spoke about so many of these things. Now, uh, the alternative, of course, would be, or the good statement to make would be, aren't all these things available in a balanced diet? Is one question. Then your answer, of course, will be not necessary, because it's possible that you could have missed this or missed that or missed that. Now, what I have learned over the years is through experience, and I want your professional opinion on this. What I do is I try and retain a balanced diet as far as I can, but I also, at my age, I also take a vitamin mineral supplement in order to remedy any inadequacy in my diet. So, would you approve of that?
Yes, that is the correct way. Sir, taking supplements and vitamins, this is very important. Now, there are three aspects of it. Like you said about your age, in your age, the absorption of vitamins and minerals are very less. It has been reduced due to your aging of your gut system. There you require supplements to compensate it. That's perfectly all right. Second condition comes if you have any chronic conditions, if you are being treated for any chronic conditions, there to supplement faster, to recover faster the deficiency of the vitamins and minerals, or to promote the medication effect, these supplements should be taken. That is also very perfect. Now comes the first aspect, the last aspect, what we say. If you are young age, if you are a middle age, and if you don't have any chronic conditions, instead of going into supplements, have a balanced diet. Every vitamins and minerals is present in our diet. Only thing, how you are going to have it is the thing. We prefer generally the young age people, they go for a fast food, having a restaurant food, the same thing, or cooking with high spice and high heat and other things kills it. If you remember, if you recall, there are now plant-based diet is very coming popular. The Ayurveda, the diet, naturopathy, like naturopathy also. If you go to a naturopathic camp, they are giving you a raw food, raw vegetables, raw salads, raw fruits, because they don't want to kill or lose the vitamins and the minerals. Nature itself has a good nutraceuticals. Take advantage of that. So all three aspects. If you are young or middle age, don't have any complications, use as much as the natural things, raw fruits, raw vegetables to compensate your to get the requirement. If you are on medication, take supplement additional to it to recover the deficiency, and age above 60 should be taking supplements as a support.
Doc W, your
So
answer comes from knowledge and wisdom. Thank you very much. Comprehensive. When you are young, you go with a balanced diet, and as you get older, you need supplements. Well done. Dr. Riku, I can see the chat buzzing, but I'm going to stop it over there, and I'm going to say thank you very much. That was an enlightening talk. But I don't think I need to give you my opinion. I will simply read from an opinion given by Susama, and it says, Dr. Wilku, you are so amazing. Well done. So that wraps up your entire talk.
thank
Susuma has
you.
said it better than I can. I can't beat that compliment. So well done, Susuma. We will use your compliment as a general compliment for all of us. And we will simply end by saying, thank you, Dr. Wilku. You are so amazing. Thank you so much. Friends,
Thank you.
Dr. Wilku would
Thank you.
never have been able to give this talk if it hadn't been for the support that he gets from his team, all of us in Arabian Wellness, RAC Hospital, IT, etc., etc. I want to thank my audience who was so kind to Dr. Wilku by calling him amazing. I am yet to get that compliment, but I will try and try again to achieve that. Ladies and gentlemen, next week we have a webinar again, so we will see you again next week. Thank you so much.